After making a conceptual model for infant mortality, I realized how important biology, the environment, and social and culture factors play a part. Starting at the bottom with social and culture factors, gender is one of the influences on infant mortality. Some cultures favor boys over girls because they believe they have the potential for future contribution to the household. Also, males have higher mortality rates than females because they're more vulnerable to infections and conditions associated with prematurity and development. Maternal education shows that having an increased education offers mothers more connections with resources for infant health and awareness of healthy behaviors. So if they're able to identify non-healthy behaviors, then it increases the chances to be able to properly respond and seek the proper help. Healthcare and resources is very important because there are some developing countries that have a lack of access to affordable and professional healthcare resources and skilled professionals during deliveries. And this could increase the chances for having an environment that is not sterile and also not safe during childbirth. Race plays a part because through the Journal of American Medical Association, they say that there's a higher rate of mortality in Hispanics over non-Hispanics, and they used examples such as teen pregnancy, obesity, diabetes, and smoking. Prejudice is in countries such as Ghana, where they have prejudice against women and newborns leaving the house. And if they're not able to leave the house, this affects them getting the treatment that they might need for their infant. Moving on to environmental factors, water and air pollution play a huge part in the development of the infant. If you have contaminated water, it houses a host of parasitic and microbial infections that are carried from animal waste, which will then be ingested by either the mom who's breastfeeding or the infant who's starting to drink water. Air pollution causes respiratory effects and sudden infant death syndrome, which will affect their respiratory tract. Carbon monoxide affects infants greatly due to their immature respiratory system. The burning of fuels increases children with having respiratory tract infections, and also if they're around people who smoke or if their mothers are smokers, this also increases the chance for mortality in their infants. Socioeconomic status is important because there are some cultures and societies that live in situations that are prone to inadequate plumbing and poorly maintained facilities, which can affect the safety and the health that their infant is living in. Sunshine and fresh air is very important because sunshine creates an increased intake of vitamin D, and fresh air is important because it cleans their lungs, ridding them of all the impurities such as fumes or dust. Moving up to the biology and family factors, starting with birth weight. Having a low birth weight or a really high birth rate are at special risk for infant mortality. Genetic components show that females are more biologically advanced to survive infancy with potential harms from infections or diseases. Poverty. There's different countries that suffer from poverty that have a pattern of epidemics and infectious diseases, and also low levels of access to maternal and child health care, which can affect the infant as it's starting to mature. Vaccinations are also very important because these are used to prevent serious diseases that could possibly infect your child. The age of the mother and the number of kids that the mom has also plays a part in infant mortality because if the mom is 19 or younger or doesn't have their first kid or their first birth up to age 29, they're at highest rates for infant mortality. So looking at all of these factors combined, if there are different parts from each of those factors that combine, it will continuously increase the rates of infant mortality. So all of these components play a part into the bigger picture of infant mortality. So if you live in a polluted environment and are also really young, that might affect the birth weight of your child and could possibly lead to having premature births, which constitute as the second highest cause of infant mortality. So all of these together play a part, and the combination of them all can continuously increase the effects of infant mortality.